It's an honor to be sharing this concept here at the consortium. And really, if you think about, this is a collection of people from all around the world whose sole goal is to improve the lives of people and families with MS and to make them thrive. And it's really the delivery of this care. And that's what, to me, is so darn special about the CMSC. The concept of interdisciplinary and comprehensive care, of patient-centered care, to me is something that we must embrace as we move forward. And as I share in my lecture, we have changed everything in MS in the last 10, 20 years. We've changed the outcome measures, we've changed the diagnosis, we've changed the definitions and the phenotypes of the disease, we've changed the tools we use to monitor, we've even changed the drugs, and yet we still see patients in an arcane fashion. You know, classic, go to the doctor every 3 to 6 months, face-to-face visit for half an hour, handshake, and then you go. And that is no longer appropriate. We cannot have value-based expectations for patients and families. We can't hope to keep them thriving and working and loving and living if we don't embrace a comprehensive and interdisciplinary way of dealing with them. And we have to do it on their terms. And so really today's lecture shares our approach here at OhioHealth, how we attempted to bring patient-centered, interdisciplinary, and comprehensive care to the patient. And then it kind of takes the next step and asks questions about where are we moving to in the future. I think that the recent developments in MS would take more time than we have. It's an amazing time to be involved in this field. And I choose my words carefully when I say, if you have to have MS, now's the best time ever to have it. Because we can diagnose faster and more accurately, we can monitor more carefully, we have drugs that are highly effective, and we no longer settle for decreasing frequency of attack. We now look at no evidence of disease activity or even confirmed disability improvement. These are all sensational things, and yet to only care for someone with disease modification is to miss the bigger picture. And so we also have to embrace the benefits of social support. We have to embrace the benefits of wellness and exercise. We have to look at preventative medicine, and we have to focus on vocation if we're truly going to be successful in helping people realize their own personal life goals and not allow MS to interfere. Diagnosing MS can in fact be challenging. MS affects the brain and the spinal cord. That's the supercomputer that runs the whole body, and the superhighway that takes all that information to and fro. So if you say, could MS cause blank, the answer is almost always yes. And you can imagine how someone comes in and shares with their general practitioner or general neurologist a constellation of symptoms that are downright confusing. I think that we have to be sensitized to the possibility of MS. And I think that falling back on advanced neuroimaging is terribly helpful. And so if a young, spry person has a numb leg, I think we are ethically obligated to dig in. And oftentimes that means imaging, brain, CT, spine, whatever it takes. I also think that a quick transfer to an MS center where there's specialists that are keen on the subtleties of the diagnosis is sometimes very, very beneficial. Not always required, but can really help. One of the new evolving concepts that's very attractive to me in MS is the concept of accelerated aging. We talk about this concept of the functional reserve. So I explain functional reserve as your nervous system's ability to withstand an insult. I don't mean you're ugly, I mean you didn't sleep last night, or your wife's yelling at you, or something like that, right? And I reflect that when I was 18, I could skip a night of sleep. I'd go to school on Friday, work my part-time job, change my clothes in the bathroom, sneak out, try to get into places on campus I shouldn't, and then come home in the morning, shower, and go back to work. Now in my 40s, just saying that to you makes me feel exhausted. And it's because my functional reserve with aging has gotten smaller. When we appreciate that the MS patient's functional reserve depletes much, much faster, it really starts to give us a better insight into what's happening. And understanding natural aging and accelerated aging, I think, is a beautiful way of thinking about the future of MS and MS care. And really what we're trying to do, in essence, is preserve the reserve. Preserve the neurological reserve. Keep what we have and allow someone and allow their brain to age naturally. And I think that has to become a focus. And we have learnings from other conditions where there are similarities. And so we need to borrow those learnings and adopt them ourselves. So how does a patient succeed? How does a patient thrive? How does someone with MS live their life fully? It's an interdisciplinary approach. It's a comprehensive deal. Starting a disease-modifying therapy, starting a highly effective disease-modifying therapy as early as possible, and monitoring with almost a zero-tolerance policy is one piece of a really big puzzle. There's so much more than that. When we talk to patients, we ask them to be 4 for 4. Take a disease-modifying therapy and make sure it's working. Exercise regularly. Avoid tobacco smoke. And supplement vitamin D and eat clean. If they're 4 for 4, that's really in 2017 what we know how to bring to the table. And I'll remark that 3 of them the patient has to do on their own. And so it's not a pill that cures that ill. It's a comprehensive approach. And to be frank, we need our patients with MS to be more engaged partners in their own care if we're going to be successful.